at the very essence of it, there really isn't a difference. A lot of people think public health dentistry is only done in a clinic style out in community, but it's not. Public health dentistry is more of a philosophy in terms of, placing the emphasis on prevention and trying to improve population health. So we're more focused on what are the overall health outcomes of a specific population and not at the individual level. Yeah, so that's another great question because we get that often asked to us, and there seems to be a lot of misunderstanding and confusion. So in the state of North Carolina, much like in other states, the practice of dentistry is regulated by the Board of Dental Examiners. And so they are a quasi-governmental entity. And so that means that they are themselves somewhat governed by the General Assembly of North Carolina. So they're really, responsible for enforcing the practice of dentistry in the state, hearing any complaints and investigating those, and making sure that the consumer is protected. So their main role, in my opinion at least, is to make sure that the consumer of the dental services in the state actually are protected and receive optimal oral health care. Yeah, so often it's referred to as the Dental Practice Act. What people often forget is that there's a Dental Hygiene Act essentially as well. And so there's really the practice of dentistry, and then that's broken out in the statutes by the practice for dentists as well as dental hygienists. The Board of Dental Examiners cannot directly influence the law through the statutory process, but they are able to make rules that are subordinate to those statutes as long as the statute doesn't contradict the rule that they're writing. So they can create regulatory laws, so to speak, through rulemaking, but not directly engaging in the legislative process. Yeah, and actually, my background in other states, it's much different here in terms of what they cover. So Medicaid in North Carolina actually is relatively comprehensive, meaning they both they offer coverage for children as well as adults. And the adult coverage is relatively comprehensive. Now, obviously, the reimbursement rates are something that providers often would like to see increased, but in terms of the actual fee or service fees that are offered, those are pretty spread in terms of all phases of dentistry. Dental hygienists really are thought of as kind of the prevention experts, and so they're really focused on providing patient education and all of the preventive measures that we like to see in dentistry to prevent oral disease from happening. So I see hygienists really as an integral part of the dental team, not saying that one is more important than the other, because the dentist really relies on the hygienist as well as the hygienist relying on the dentist. So at the end of the day, what we're really wanting to see is comprehensive oral health care for the patients or for the consumer. That includes both restorative care if it's needed, but obviously a need for heavy prevention, which that's kind of the sweet spot for dental hygienists. It really goes back to scope of practice. And so when we look at hygienists in terms of their scope in North Carolina as compared to other states, we find that there's more restriction in terms of what they're able to do. And one example I would give you is in this state, they're unable to deliver local anesthesia, whereas in the majority of the states across the country, that is not the case. So often what we find in North Carolina, from what they're taught and instructed in school to provide, actually is not what they're able to provide once they're licensed in the state. Yeah, so in the state of North Carolina, we have a subset of hygienists that are functionally both the same as a non-public health hygienist, as well as a little bit dissimilar in terms of their training. And so really what it means is once a hygienist is licensed in the state and they meet certain eligibility requirements, and those are namely having 5 years of clinical experience or 4,000 clinical hours of dental hygiene experience, they can then sit for a specific training that's offered through the oral health section of DHHS, and then they are deemed a public health hygienist. And so the reason that's important is their scope of work is a little bit different. So again, they're focused on, the preventive measures out in community and meeting patients really where they are outside of a traditional dental office. And they're able to perform those procedures with a little bit more leadway based on some of the regulatory rules that have been passed that are only specific to public health hygiene.
Thanks for tuning in for the first of many conversations we will have to answer your questions. Want to know something about dentistry in North Carolina? Send me an email or fill out the form in the text of this post, and we may feature your question in an upcoming episode. We'd love to stay in touch, so follow us at Oral Health NC on Twitter, LinkedIn, and Facebook, and sign up for NCOHC News today.